नमस्कार दोस्तों, आज हमारे साथ एक पेशेंट और हैं एंड ही इज चंद्रशेखर, जय चंद्रशेखर। एंड अभी मैं हमारे हॉस्पिटल में हूँ कर्मा आयुर्वेदा में, जहाँ पे हमारा 40 बेडेड NABH हॉस्पिटल है, NABH अप्रूव्ड हॉस्पिटल है। और ही इज फ्रॉम चेन्नई, ये चेन्नई से आए हैं एंड ही इज कंफर्टेबल इन इंग्लिश, सो आई विल बी कन्वर्सिंग विद हिम इन इंग्लिश ओनली। So welcome to Karma Ayurveda, Mr. Chandrasekhar.
Thank you.
How are you feeling over here?
I am feeling great, and I've been here for last 8 days, and I feel at home. Okay, I don't feel like I am in hospital. Okay, all staff, doctors, everybody are friendly, and I am very happy to be here, and always thinking positive and going through the routine of yoga, going through the routine of therapy, going through the routine of acupressure, okay, all these things. So it's all going on time, and food is also very tasty, very lovely in spite of the restricted spices. So I enjoy the food also. So everything is going on very well.
So what was the creatinine level, Mr. Chandrasekhar, when you first visited us over
See, the creatinine level, so far highest for me it has gone is 2.8. Okay, this is the highest 2.8 value, and apart from creatinine I don't have any other issues like burn or urea or any other electrolytes. Everything has been normal right from beginning, but somehow creatinine has been high. The first I noticed this is sometime around 2014, okay, last 10 years back, and that time there was some statin tablets given to me, and statin had pushed my creatinine level from somewhere around 1.6 to 1.922, and then there was one tablet given by a cardiologist which pushed that, and painkillers pushed my within 1 week it pushed my creatinine from 2 to 2.7 allopathy. Then I stopped taking allopathy totally, and from that time, almost 7 years, I'm taking 8 years, I'm taking only Ayurvedic. Okay, I am fed up of allopathy. Okay, at least allopathy doesn't suit me. So I slowly, I first contacted few doctors in Ayurvedic doctors in Chennai, and those doctors' medicines were able to contain my level, but not able to decrease the creatinine value. They maintain my level, okay? It did not increase nor decrease. But I came to know about Karma Ayurveda. I joined Karma through website, and 6 months I've been taking treatment in Karma Ayurveda. After I took treatment, first time I could see my creatinine level going down from 2.8 to 2.5, and I have now joined the IPD. I have not taken report after joining the IPD. It is due for tomorrow. Once I take the report, I'm sure I am expecting the creatinine to come down at least by 0.3, 0.4, something like that, or touch closer to 2. If it comes closer to 2, then I can maintain all the. Now I am more aware, conscious of what diet I have to take, what how medicines I have to take. Everything I am pretty aware. So I think I will go on a specific routine. I'll avoid outside food, all those things, and that should keep me a better stead as far as controlling CKD is concerned.
Definitely, yes, Mr. Chandrasekhar. And there has been a phenomenal improvement in case of Mr. Chandrasekhar. The creatinine level were quite high when he first visited us. When he first started the treatment, वो लगभग आपका creatinine was around 2.7.
Yeah, 2.8.
When you started 2.8, 2.8 was the creatinine level, and it has came down to 1.7 during the 6 months of treatment. He's come down all the way from Chennai to Delhi to get the treatment from us, and there's been a phenomenal improvement. Last 6 months he's been taking treatment, our treatment, and from the last 8 days he's staying with us in the IPD. And I will also request the camera person to just show the room so that people can come to know what all facilities we are providing in the during the stay. There's a normal single room with a bed and all the amenities are there, and the food is also very good. वो कहते हैं कि अगर फूड अच्छा होता है तो मन ज्यादा लगता है. फूड अच्छा होने का मतलब स्पाइसी और वो नहीं है. खाना अच्छा होता है तो बाकी चीजें भी सही रहती हैं, ताकि खाना मन भी संतुष्ट रहे और आपकी बॉडी भी संतुष्ट रहे. वो बहुत जरूरी है. Mr. Chandrasekhar, who has came all the way from Chennai, is having a great time and is feeling very well, is recovering a lot. Would you like to add something along with this for all those patients who are also suffering from the CKD problem?
Yeah. So I want more people to, whoever is following allopathy, to slowly move to Ayurvedic and take Ayurvedic treatment, because Ayurvedic, see, people, when I approached a doctor, nephrologist, I asked him if I continue allopathy, will he make sure that I do not get into dialysis? He said I cannot guarantee. So when he cannot guarantee that I dialysis, that I cannot prevent dialysis, what is the point of going to allopathy? Then I thought I will continue with my Ayurvedic treatment,
right.
And at least Ayurvedic, there is a scope for me to decrease and at least stable,
Right.
not too much of variation.
Right.
So, and I could see results here. In Karma Ayurveda, I could able to see results in 6 months' time. And I want to continue, and I'm sure I will become normal in another 6 months. And I can be like any other person. And I can enjoy some outside food after long. Maybe in another 1 year I can do that.
Sure.
So that is what I hope. And I am under the good care of Dr. Puneet and other doctors, okay, under him. So they take care of me.
Can you see the hands? The patient has gone through medicines, diet, yoga, acupressure, and acupuncture. Suju also the patient has gone. Sujok, yeah, Sujok, right. Sujok patient has also done along with the acupressure. Acupuncture also you are doing, acupressure,
Yeah.
yoga भी कर रहे हैं. क्या routine रहता है आपका पूरे दिन का यहाँ पे? What is the current routine that you are following throughout the day?
Yeah. Morning we start the day with kada.
Okay.
They bring the kada at 7:45 or something.
No.
And then
All right, please continue.
Then we have yoga, and then we do yoga for 45 minutes. And then after yoga, I get breakfast, and breakfast this is for renal specific breakfast. I get the breakfast, and after breakfast, I am called for therapy. So there is at least 3-4 therapies in a day for these patients. I attend to 2 therapies and undergo 2 therapies in the daytime. And post lunch I attend another 2 therapies completed. In between I take some rest, and just now before this video call I had fruits, and I took fruits, and then around 1:30 I will get lunch, so I'll finish my lunch, and then night time I'll get chapati I get about 8 chapatis plus sabji for lunch and dinner. Evening again we have routine yoga continuing for another 45 minutes. I go for a stroll, and then we have in the garden we have some specific type of stones where we walk on the
Reflexology.
okay.
Yeah.
So where we walk for improving our diabetes, reducing our diabetes, and improving our
Blood circulation.
everything. So that we continue, and we also chat with some other patients and staff as well, because they are very friendly with us, and we go about our daily routine this way, and we get good sleep also, because the environment, it's very important that to get a good sleep we have to be positive, and we get the positive attitude here, and we get the right type of people to be mixed with, so I am able to sleep well.
Chaliye, that's a very good thing. And Mr. Chandrasekhar is actually from Chennai, and it's a very long journey from Delhi to Chennai.
Yeah. Yeah.
So you're feeling that the changes in the reports were there and the improvements were there, which led him to come all over to Delhi and stay here for around 8 to 10 days. So how long is your stay from here after these 8 days?
So after this, I'm just planning to go to Uttarakhand for a few days, and then back to Chennai.
All right.
Yeah.
It was a nice talking to you, and we hope that you fully recover and just follow everything what we are prescribing from here, including medicines, diet, yoga, exercises. You're going to see, with God's grace, you're going to see good changes.
Thank you.
Thank you so much.